Hello everyone. This Methods for Scientific Inquiry presentation is focused on focus groups. Group members are Sabrina Pettigrew and Lauren Tucker. Focus groups have been used in sociology and psychology since the 1940s. This research method became a way to bridge the gap between research and local knowledge. Today, it is utilized in numerous disciplines, including education, health, media and communications, and marketing research. Focus groups are made up of selected participants who are alike in some way. A moderator is used to help guide a discussion on a focused topic. The moderator should be similar to the participants and not participate in the conversation. Focus groups aim to better understand social issues. This research method is qualitative because it is an observational technique that does not directly measure numerical results. However, analysis techniques such as the 3-coding framework or data coding may offer quantitative results. There are 7 steps to complete the focus group research method. First, define the objectives and purpose of the study. Develop key questions. Second, identify and recruit participants and a moderator of similar demographics. Decide how many focus groups are needed for the study. Next, find an accessible location to host the discussion. Then, prepare for the discussion and make a script. Next, facilitate the discussion or prepare a facilitator for the discussion. Set ground rules, observe and record verbal and nonverbal behavior, track questions and themes. Be sure to record the session. Step 6 is analysis. Focus groups can be analyzed by content, discourse, or conversation, or through listening, ranking, or coding. Lastly, report the results to the intended targeted audience. An example of this type of scientific inquiry is an article by Kali et al. Titled Exploring Rehabilitation Potential in Older People Living with Frailty, a qualitative focus group study. This study was designed to explore perspectives of rehabilitation potential in older people living with frailty in the acute healthcare setting. There were 3 objectives to this study. 1. How do clinicians, patients, and caregivers understand rehabilitation potential in older people living with frailty? 2. How is rehabilitation potential assessed in the hospital and community setting? And 3. Identify evidence to inform the development of a tool to support consistent decisions about rehabilitation potential. The study was advertised to healthcare professionals, patients, and caregivers with experience with elderly rehabilitation in an acute, subacute, or community setting. Purposive sampling was used in the selection of the 28 participants for this study. There were 5 focus groups, each consisting of 5 to 6 participants. The location, dates, and times of the focus groups were made convenient at locations away from healthcare facilities. A focus group topic guide was developed using findings of a systematic mapping review and supplemented with clinical experiences of the study team. This was to ensure participants stayed on target and the study's objectives were met. The groups were facilitated by team members and included a moderator, who is a clinical academic physiotherapist, and an observer, a patient and public involvement member. A deductive framework analysis was used and reviewed by the study team to ensure resulting codes were grounded in and supported by the data. Field notes and audio recordings of the interviews were reviewed and transcribed. Analytical notes, key ideas, and impressions were generated. This study found that the term rehabilitation potential was poorly defined in clinical practice and meant different things to different participants at different times. It was suggested that future research focus on the development of structured approaches to decision-making about rehabilitation. There are several advantages to utilizing focus groups. It offers diverse responses. It can confirm questionable results from other qualitative methodologies. Participants feel empowered by giving feedback. It is cost-effective. It is a time-saving method that offers multiple opinions and feedback. It typically provides even more information than the original focus topic aimed for. There is a level of anonymity. No one knows each other, which fosters honesty. Focus groups provide rich feedback with opportunities for relevant brainstorming. There are also some disadvantages to using focus groups. They are challenging to organize. Participants have less speaking time than one-on-one interviews. Some may dominate the discussion, which warrants a strong moderator. There can be moderator bias, which can inadvertently lead a discussion somewhere unproductive. Some participants may expect compensation for their services. Some subjects are highly debated and may result in heated discussions, threatening the safety of participants. Some participants may struggle to stay engaged in conversation for multiple hours. And lastly, some participants may be distracted or unwilling to participate on the day of due to personal reasons. Here are the references used that provided the information for this presentation. Thank you for listening.